The only thing the cell knows is it's seeing glucose. It doesn't know where it came from. It's not cognitively aware where that sugar molecule came from. Once inside the cell, and by the way, this represents what happens inside the cell. This represents what happens inside the cell. Once those sugar molecules get inside the cell, cholesterol and fat are produced if one is overeating carbohydrates. And by golly, in the amount of carbohydrates that we're told to eat, via the food pyramid, which is 100% wrong, we're told to eat 250 to 300 grams of carbohydrates a day. Whoa. Generally, the answer is no. Most of us should be under 100 grams a day, under 100 grams of sugar a day. So why whole wheat bread? The simple, this is going back to Lucy from Dayton, Ohio. The simple answer is because sugar is sugar is sugar. The cell is not cognitive where the sugar molecule came from. Okay, so this is why you need to avoid sugar-containing foods. Let me sugar in general. Again, I'm not talking about 100% avoidance, but let me just because what I do for my patients, which I'm going to do for you today, is I like to go through the avoid list and the may eat list. The avoid list and the may eat list. And the avoid list is as follows. And I'll say this slow because I've gotten so adept at saying this, I can say this in 2 seconds. Okay? Bread, pasta, rice, corn, carrots, potatoes, cereals, fruits, fruit juices, beets, cakes and candies. One more time. Bread, pasta, rice, corn, carrots, potatoes, cereals, fruits, fruit juices, beets, cakes and candies. Common denominator, sugar. Many disguises, but sugar. What you can eat is the following. Meat, red meat, lamb, pork, chicken with the skin, cheeses, cold cuts, eggs, including the yolk, dark green leafy vegetables, that's your kale, your spinach, your asparagus, that's your broccoli, and of course cauliflower, which is not green, is also included in there. Butter is better, and mayonnaise is fine. So that's your may eat list. And I did that because I have a question here from Ann from Shoreham. Let me just bring it up. Oh, I have another question. I'll get to that in a second. Okay, I like this one because this is basically confrontational, and this is the tone of a lot of physicians or a lot of people who think that I'm dealing with my beliefs. Okay, do you honestly believe that eating an equivalent serving of beef is healthier than eating an apple or any other piece of fruit? I don't. Okay. Well, again, what was the first thing here? Belief. Do I honestly believe that eating? No, I don't believe that. It's not a belief, it's a fact. And basically, it's a very interesting question, and it must be stressed that I don't believe anything unless I've seen it clinically, unless I can break it down biochemically, physically. So what I've seen in my clinical practice is what I've seen by giving people whole grains and fruits. They can't come off their medications. They still need to stay on their medications. And it doesn't help in treating any disease process. And I'm a little confused here because I don't know what an equivalent serving of beef is. In other words, what's an equivalent serving of beef versus an apple? Like, how do I equate beef, apple, or fruit? You can't. Because beef is cholesterol, fat, and protein, and apple is simply sugar. Remember, what Dr. Carlson says, an apple a day, and the doctor you will pay. Okay, that's what I say. All right? So I don't, to answer that question, I'm not dealing with my beliefs, and we need to get off that, that discussion because I'm really not dealing with beliefs. And let me get back to this a little bit. I want to take some time now to discuss something that is really controversial when I say it, and it's the truth. And it really blows doctors' minds and nutritionists' minds. And the nutritionist, by the way, which I failed to say, about a week and a half ago, I told you that I gave a lecture for the bariatric seminar at a local hospital. After I spoke, the nutritionist came up to me, not in a confrontational manner or anything like that. And she looked at me and she said, we really have to talk. And, she wanted to learn. And I got really excited over that because now here's somebody who wants to learn, who's not cynical of me, who's not out there thinking that I'm telling you what I believe in and whatnot. But let's get back to some really controversial revolutionary, concepts which are true, okay? Now, look at this equation here. This equation here, this says total cholesterol equals the summation or the addition of something called the HDL, the LDL, and something known as the VLDL. So total cholesterol is the addition of a molecule called HDL, which is your good cholesterol, something called the LDL, which is allegedly the bad cholesterol. I'll destroy that myth in a few seconds. and something known as the VLDL, which most lay people have never heard of. HDL is high-density lipoprotein, LDL is low-density lipoprotein, and VLDL is very low-density lipoprotein. So the HDL molecule, the way you remember HDL as being the good one, think of H as standing for healthy or high. So you want this high to be healthy. Now, my problem is with the LDL, because a lot of doctors will say, well, think of the L being lethal and the L being low, so you want this low to decrease your lethal problems or whatnot. Well, here's your problem. Once your HDL, or good cholesterol, gets above 59 or 60, it changes the characteristic of the LDL. See, there's many different types of LDLs, there's many different types of HDLs. So once the HDL gets above 59, 60, it'll change the LDL molecule, and the LDL molecule will actually become a safer molecule and will actually protect you against heart disease. So no, LDL is not always, dangerous to have. But look at this equation again. This is a simple equation. In my book, it's chapter 5, I mentioned that there's a show out now called Are You Smarter Than a Fifth Grader? Okay? Now, when it comes to physicians and their understanding of simple basic math, the answer is no. They are not smarter than the fifth grader. But I shouldn't pick on the fifth graders, because my daughter in second grade, knew simple addition. So it really should be, are you smarter than the second grader? I think I've insulted enough people, I'll be quiet with that. But go back to that equation. Let's look at that equation again. And what you see is that total cholesterol equals these things, right? Well, okay, all things being the same, if these things stay the same and you raise your HDL, what do you think's going to happen to the total cholesterol? You raise the HDL, what do you think's going to happen to the total cholesterol? That's right, it increases, okay? Put the numbers in there for yourself if you can't see that. So if you have a very good HDL of 59, 60, or 70, it's immediately going to raise the total cholesterol. So if you have a total cholesterol that's above 200, it doesn't matter as long as the HDL is above 59, okay? It doesn't matter. Unbeknownst to a lot of clinicians out there, back in the 1950s, we knew that individuals whose total cholesterols were between 240 and 280 had lower heart disease risks, lower. What we didn't know about is the HDL. We did not know about the HDL. I guarantee you those people's cholesterols that were 240 to 280 had stellar HDLs, 59, 60, 70, and they were fine. You see, we're not understanding this simple equation for what it is, and we need to. Another fascinating fact, not belief, not theory, not opinion, not supposition, is that lowering total cholesterol has never been shown to lower one's risk for heart disease. Let me say that again. Lowering total cholesterol has never been shown to lower one's risk for heart disease. Let me say it a third time. This goes to the pharmaceutical companies. Lowering total cholesterol has never been shown to lower one's risk for heart disease. So why do physicians give you cholesterol-lowering medications? To lower your total cholesterol. There's a medication out there. Now, I got to say this, okay? I'm not going to say the name of it because I don't have enough money to pay for a lawsuit, okay? But I'm telling you the facts here. It actually says, I almost said the name, using this medication has not been shown to lower one's risk for heart attack or stroke. Please ask your doctor about this medicine. I'm like, what? You just told me that your medication doesn't do anything, and now you want them to ask me about it? Are you kidding me? And you know what? They did make a true statement, because lowering total cholesterol has never been shown to lower one's risk for heart disease, okay? What I'm leaving out is that medicines like Crestor, Lipitor, the other what are called statins, they're not being used to lower cholesterol, although that's what your doctor will tell you. They're being used for something called plaque stabilization.